with you today is the pinnacle of my 30 years in acupuncture, which culminates in one point, one acupuncture point, which I named Dr. Tan's Grandmaster Point. To introduce myself and to give you an idea what I'm working on and what I'm talking about, please allow me to show you this video.
Yeah, get rid of the pain with all the needle. Isn't that incredible? Just so easy. Some minutes and you're free of your pain. Wanna know how this every technique is like magic, even if it sounds that way. And you'll be a weekend away from heart. Back on to the time. Back on to the time.
I'm really excited to bring our next presenter up to the stage. Dr. Thay is a multiple international award-winning acupuncture expert on instant pain elimination. Who couldn't use a little bit of that? He is the founder and director of Turbo Acupuncture Academy and one of Europe's largest physician-led practices for acupuncture. Before that, he was senior resident and temporary deputy of the head of the first German hospital for TCM, University Hospital at Beijing, University of TCM in Germany. He's the first ever outside of China who was granted the inherited master fellowship of Kilu School of TCM for complex diseases. He's one of 64 acknowledged inherited schools of TCM in China. He's the host and chairman of the first World Summit on Turbo Acupuncture for instant pain elimination. And his superpower is instant pain elimination using only one acupuncture point. Please welcome to the Global Entrepreneurship stage, my good friend, Dr. Thay Tan.
So that was at United Nations headquarters in New York in June 2019. And what follows is a 10-minute talk about turbo acupuncture as the new revolutionary gold standard in pain medicine, and actually which can be the global solution to pain. So I'm based in Stuttgart, Germany. Stuttgart is the capital city of the federal state of Baden-Württemberg, so southwest of Germany, home of Mercedes and Porsche. And it is one of the reasons why I named my style or type of acupuncture turbo acupuncture. Turbo, like the turbo engine, very fast, very powerful. Well, because that is how turbo acupuncture works, very fast and very powerful in learning, application, and effect. Right, so I'm currently on a world tour. This one, unfortunately, I had to cancel the last one, but next week I will be in England. So, Dr. Tan's Grandmaster Point, the pinnacle of my 30 years of journey in acupuncture, and before that in Western medicine and dentistry even. Turbo acupuncture, maybe I want to explain turbo acupuncture a little bit more. Turbo acupuncture is based on just 12 acupuncture points. So normally, if you have this, I mean, some of you may be familiar with acupuncture, some of you maybe not. So this is an acupuncture doll, right? And all the meridians and all the points are on this puppet. And there are like 360, 365 points, plus some extra points and so on and so on. So it's a little bit a kind of effort to learn this all, right? So, and turbo acupuncture is the form of acupuncture where you just need to know 12 out of all these points. So you don't need to spend years learning hundreds of points and then the action and interaction and contraindications and so on. And this can be learned in one weekend. And this turbo acupuncture point, the grandmaster point, is the best, my best of all points, which I want to share with you today, so that actually everybody of you who want to eliminate a certain type of pain, but many other medical conditions could do that actually, if you have a little tool, and the little tool is this little tiny needle, right? This is, let's call it turbo acupuncture needle, and this is a normal standard acupuncture needle. So there's a difference in size and length and thickness. So obviously the turbo acupuncture needle is smaller, thinner, yeah, and it's typically used in hand acupuncture, Korean hand acupuncture. However, so the success rate of turbo acupuncture in pain normally is 19 out of 20. So 19 out of 20 patients with any kind of pain, physical pain, I mean, will be helped with turbo acupuncture. And there's only 1 in 20 where it will not help. So 1 in 20 is 5% non-responder. I want to emphasize that becoming pain-free is for now. I didn't say it's for good. Normally the pain comes back, but not as bad anymore. So maybe next time means next day, 2 days later, 3 days later, the pain comes back, but not as bad anymore. Maybe two-thirds, a half, and then you need just to do it a few times until the pain will be gone for good. There are 3 secrets to instant pain elimination. And instant means immediately, and elimination means from whatever the pain is on a numeric rating scale between 1 and 10, bring it down to 0. So it's not the pain reduction of 50% or so. So it's really bringing it down from whatever it is to 0. Right, so the 3 secrets, or we can call it the 3 keys to instant pain elimination. And I want to show you a couple of patient videos who experienced turbo acupuncture, what they say.
Wow, I am amazed. I was run down by a moving van 4 years ago when I was trying to cross the street in Los Angeles. The van hit me and knocked me about 15 feet through the air, and I was taken to a trauma center to find out what was broken. And they couldn't find anything broken, but I have been in extreme pain since. I've gone to acupuncturist, I've gone to acupressure, I've gone through doctors that do the epidurals in my back. I get tramadol shots in my arm. I've tried everything. I've been to a neurologist. I can't get the pain out permanently. I have every drug possible: oxycodone, OxyContin, morphine. Morphine they give you when you're dying. So, but that's the kind of pain I'm in. And I met Dr. Tan, and he told me he could do this. And I said, no way. I've been there and done that, and I know better because I have a lot of pain. 1 needle, he got my lower back pain gone. A second needle, he took the pain out of my shoulders. I'm shocked and amazed. Give this a try. It is worth your time. You will be out of pain. I'm shocked. I'm totally blown away.
So this is one, and this one here.
Wow, I'm pain-free. It's really spectacular, and I can't believe it. The pain that I was experiencing was holding me back, and I had tried everything to get rid of this pain. Dr. Tan, with 1 needle, within just a few seconds, maybe a minute, the pain that I was experiencing was completely gone.
Hi, everybody. I've just experienced turbo acupuncture, and I've had problems for probably 40 years. And I've had instant relief from this treatment.
The pain is gone. The pain is really gone.
Oh, I've had a headache for about 3 weeks. One needle and in about 10 seconds, it was gone.
I had fallen down a flight of stairs 10 years ago, and I had several areas in my back that were bothersome at a level 3, 4 pain consistently, even with taking pain medication. I was totally amazed. One needle, and within, I'd say, less than 30 seconds, the pain was completely gone.
I was sore all over, trying to stay awake and everything else. He put one needle in and my neck started to it was almost like somebody took the pain and started draining it out of my neck. Little by little, it started draining to the point where it was gone. And I'd say probably about 15, 20 seconds. My head right now is just unbelievable. I have had sinus issues for so many years. I can't remember how many years. And now it's off. So I just love how I feel right now. I'm just like 20 years younger right now. To me, I would pay any amount of money to get this service. I mean, it's not like normal acupuncture. Well, it's turbo. I love the name because it's fast. It's fast and it's effective, and I feel great.
So I've had basically chronic back pain, and it's been pretty persistent for several years. It's the first time I received acupuncture for this type of pain. The results were almost immediate. The needle that went in, it was painless, and seconds later, the pain was alleviated. Right now, it essentially feels the same way. I'm pretty much pain-free from the condition that was alleviated yesterday evening.
So I could show you many, many more, but just one more for a special reason. And I will stop this video at one critical point.
Hi there, my name's Graham. I've had plantar fasciitis for 8 months. The pain's been so bad. I haven't been able to work, I haven't been able to walk, I haven't been able to run. I've been on 1,600 milligrams of ibuprofen for 3 months now. And within 3 minutes and...
So here, I stopped this video here now because here you can see Dr. Tan's Grandmaster point in action. This is the middle finger, right? And you see here are 4 or 5 needles in one point. Different angle, different direction, but this is one point. So this is one of 12 turbo acupuncture points. In his case, basically, turbo acupuncture can be used for anything, but I put in the forefront the pain because there's so many pain patients, like 23 million in Germany, 28 million in UK, 80 million in the US, and this is one of 12. So he had plantar fasciitis. That's not the best, or not the only indication for this turbo acupuncture point. It's even better for something else I will share in the end, but just to show you how it looks like in practice. And then this man, he said the pain was so bad that he was thinking of amputating his leg because the pain is so bad, right? And this was like, he says...
6 needles, the pain's gone. I mean, it's just insane. The pain's completely gone. I just can't believe it.
So that was 6 needles, 4 or 5 in one point. And I met this man like 1.5 years later. I met him on WhatsApp again, and he said he hasn't done anything else, no other acupuncture, physiotherapy whatsoever, and the pain is still gone. So that's exceptional. That's not the rule. Normally, the pain comes back, you need to do it again. So normally you need to do it 10, 12 times until the pain is gone for good. But the main difference to normal acupuncture or any other kind of treatment is that the pain is gone now. I mean, within seconds normally, right? So if it's half a minute, that's already long. If it was 5 minutes, that would be ultra long. But against the background of patient having pain for months and years and decades, even 5 minutes is short, right? So this type of acupuncture and all the videos you can find in the internet brought me all these awards, right? So I asked, why did I receive this award? They said, why did they check the internet and there was no other doctor having so many videos, patients' testimonials about the effect of this therapy that they thought, okay, then he deserves it, right? And there's one, there's second, and many, many more. And this is the one I'm most proud of, actually. The diploma of Master Fellowship of Chilu School of TCM for Complex Diseases. This is the the director of this branch, one of 64 schools, traditional schools of Chinese medicine, which are accredited in China. I taught my method, presented my method in about Johannesburg, like 2,500 people, German Doctors Conference, even in China, because they don't know it. So these two pictures are from Beijing University, Dongqimen Hospital. That's the one teaching hospital of Beijing University, which has the international department. And this gentleman in the blue shirt, that's the head of the acupuncture department, which I treated with my turbo acupuncture method. So basically on this chart here, you can see the Da Vinci Code for pain elimination, all on one chart. Well, so my personal record is like at a 3-day business event in Germany, where I agreed to meet with 5 people, which I got to know during the breaks. I said, okay, let's meet on day 2, 5 people. While I was explaining to them how we do it, arranging it, another 30 people lined up. In the end, there were 35 people and had just 1 hour to do it, right? So of the 35 people, 32 became pain-free or almost pain-free. Only 3 were low responders. 1 of them I resolved the next day. So, but this is something which works, right? And it's not my person as a therapist, it's the methodology that everybody could learn. So now back to the 3 secrets or the 3 keys of pain elimination, instant pain elimination. Number 1 is having an open mind. Whether you're a doctor or the patient, you need an open mind. Zhuangzi, one of the famous Chinese philosopher, beside Confucius, of course, and Lao Tzu, said in Chinese, of course, but this is in English, the mind contains everything, right? So if you can believe it, or as Napoleon Hill says, if you can conceive it, then you can achieve it. That's number 1. Number 2 is you need to understand pain, right? If you want to play the game of eliminating pain, treating pain, you need to know the rules. And then what Albert Einstein says, play it better than anybody else. And the way how Western medicine understands pain from, let's say, from the reason, or how do you say, the thing which causes the pain, the nociceptor, the nerve conduction, and chemicals, neurotransmitters, and then the synapses, and in the end, it's in the brain, and there's a memory, pain memory. With that approach of understanding pain, humanity is left behind with all these millions and tens of millions and hundreds of millions of pain patients, right? Understanding the pain a different way, Chinese way, it can be very easy. So that is very important to know how to understand pain. And there's one Chinese colleague here I see. So I'm not Chinese, right? Well, I'm Chinese from origin, but my parents were born in Indonesia, but their ancestors come from China. That's why my name is Chinese. And one crucial sentence in Chinese medical classical literature is "tong zu butong, butong zu tong." Maybe the pronunciation is not so good, but our Chinese colleague Kevin, you probably recognize that. "Tong zu butong, butong zu tong." Where is pain, there is no flow, and where is flow, there is no pain. So the flow or the pain and the flow or no flow is directly correlated, right? And what is it? What is meant? What is flowing and what is not flowing? It's the qi, the vital energy, and or the blood or both, right? That's the only thing. So basically, it's all about the blockage, which you need to unblock. And key number 3 is you need the right therapy, like in this case, acupuncture. Could be homeopathy, could be anything else. You need the right system inside the therapy, inside the methodology. So because only if you have a system, then you can repeat it, then you can have always the same result, right? The recipe system is like a recipe, like you have the ingredients, you have the amount of the ingredients, you have the sequence in which you put them together, you have the temperature, and you have the timing, right? And if you do this, if you follow this system, this recipe, one by one, then anybody can do that, right? No matter who does it, the result will be always the same. And then number three, or 3C, you need the right therapist if you are the patient, or you need the right teacher if you are the therapist, right, to learn how it works. So now, Dr. Tan's Grandmaster point. What is that one point able to do? As I said, this is the pinnacle of my 30 years of acupuncture, learning from, I don't know where it's in the hundreds, but a high double figure number of teachers and professors I had from all over the world. And this is the best of the best I share with you today. What is it good for? It can make people feel better with pain in general. Pain in general, so any kind of physical pain, and this could also be emotional pain, but it's not super selective. Super selective is real turbo acupuncture, right? For any, let's call it for any pain, or let's say for any pain location, there are different points to use. But this one point here, one of 12 points, that can be used for any pain in general. It will make the patient feel better. It releases stress, it releases tension, whether it's muscular or emotional. It helps anxiety, helps with insomnia, depressive episodes, any colics, cramps, menstrual problems, whether it's the mood, whether it's the pain, whether it's the breast tension, maybe digestive problems. And this Dr. Tan's Grandmaster point is the best point of all for any kind of genital pain, male, female, genital pain, only that one point. So now I want to share, I have 5 minutes to share with you where the point is. For that, I need to draw, right? For that, I need to unlock my iPad here. So can you see this? Ja. Den Change freigeben und wird wieder optimieren. So. Oh, where is it? Warte mal, Teilnehmen freigeben. Bildschirm. Okay. Can you see it now? Should come here. So that's my whiteboard, right? So I for you the point. You saw, remember that man? He showed you the hand and the needles were in the middle finger, right? So basically, it doesn't matter left or right. It's on both sides. But if it doesn't matter, take the left side because of this. Okay, this is okay. Dr. Tan's Grand Master point. Let's take the left hand. So this is 1, 2, 3, 4, 5. Left hand, not the right foot. The nails. No, Dr. Tan's Grandmaster point is located here. I will make it bigger, and the name of this point is pericardium 9. Right, so it's pericardium 9. Now, pericardium 9, if you look in books or on the puppet, pericardium 9, sometimes it's indicated there. Sometimes it's, let me show you. Sometimes it's here, Sometimes it's even there. So on this puppet, it is here. But what I promote and what I always use very successfully is, and for that reason, I will erase those other ones, this point. So it's radial, the middle finger radial. And very exactly, put this here. Now, let's say this is the middle finger, right? And then there is a nail. So, and here is ulnar, and this is radial. How do you find the point? You draw, how do you call it in English? A tangente. So from this point here, a line, right, touching this point, and the other line perpendicular on the first line from here down there. So there where these 2 points cross, there is the point you want to needle. Now, first of all, you need to know the name of the point is pericardium 9. Second, you need to know where is the point. Third is you need to identify the exact location, which can differ from the perspective on how you look on the finger, right? I always say, okay, the first perspective you have, just put it there, like here. I will show you the direction and angle in which you are supposed to needle that point. And second, yeah, needle it like that. And if the effect doesn't come immediately as it should, then you need the second needle in the same point. But the same point means it'll slightly off. It can be up to 0.1 millimeter off. So very, very slightly. So the first needle goes in here, goes from here. It goes from here. So you have 45-degree here, 45-degree here, and the needle is 45 from the surface, right? So it's basically triple times 45-degree. You put the needle on this. It's this little tiny needle, right? You put on the point, and then there's a special technique how to do it so that it's the patient shouldn't feel anything. Like you do a quick rotation. I mean, if you do it like this, you poke the needle like this translational movement, that's painful, right? The patient will not like it. But if you make a quick rotation, so you have the needle on the point already, the needle touching the skin, but not penetrating the skin, just touching the skin very gently. And then you make a quick rotation, clockwise, a very quick rotation clockwise, and more or less at the same time, you withdraw, right? So there's quick rotation. This movement itself will make the needle find its way through the skin, right? And in the end, the insertion depth is maybe only 0.2, 0.3 millimeters. So very, very shallow, right? So just that the needle is standing and not falling, right? So now, the effect should come straight away. What you might need to do is the pain or the location where the pain is, let's say it's genital pain, you need to, well, not you yourself, but you can ask the patient to do it, manipulate a bit. So bring a little bit of movement in that area. Remember, pain is only a blockage, right? So by letting the patient move that area, and you stimulate the needle, and stimulation is just not a lot of turning around it. So just touch it a little bit, just add a little bit of vibration to the needle, right? But be aware, because the needle is only 0.2 millimeters in, you need to support yourself so that the needle doesn't fall out, right? So let's say you did all what I said, but the effect doesn't come, right? So then you need a second needle in the same point. If I say the same point, you look from a different direction, look from a different angle. And if you look from a different angle, then you will see, oh, the first needle, which from the first angle, first perspective, looked precisely inserted, from a different angle, it looks like 0.2, 0.5 millimeters off. It should be. Now you go from this angle, which is from, you look at the finger from very distal, right? So you look at the tip of the finger, and then you insert the second needle. So from here, at 30 degree, sorry, at third, well, what, this is not good, at 30 degree, 30 degree, 30 degree means the ninth degree would be like this, right? And 30 degree is like flat, so flatter than the 45 degree and in the direction of the meridian, right? So this one is actually even more powerful than the first one. But why do I do the first one? Why do I not just do the second one? Because if you are not so accurate with the first needle and you did this 30-degree needle first, then you do not see very well anymore, right? The sight is blocked by that needle. If you do 45-degree needle first and you hit the point accurately and the effect is there, fine, that's it, you're done, right? But if the effect doesn't come, then you still have free vision of that area so that you can place the second needle very precisely. So now the form of the needle could be like I showed you here, but sometimes the needle is like more V-shaped, I exaggerate a bit, or more this shape, right? In this case, you still use this point as reference, put a line here, and then put a line from here there, and then here is the point you want to insert the needle, or in this case, basically it's very, very, very close to the corner there in the skin, right? So first needle would be like this, for 45, 45, 45, and the second needle would go like this, 30 degree, right? So that is the pinnacle of my 30 years of acupuncture, plus before that, Western medicine and dentistry. And acupuncture was basically the third thing I did. Yes, so, and because that point is so powerful, because it has such a broad spectrum of indication where it helps, this is so, I call it grandmaster point. And if there was only one point, or if there was only one thing I would be able, or I would be allowed to learn, let's say everything would be taken away from me and it need to start all over again, I can do only one thing, I would definitely learn turbo acupuncture, because that's so powerful. In 1 week and I can achieve so much impact. And if it was only one needle, one point, it would definitely be this point, pericardium 9, Dr. Tan's grandmaster point. Yes, so, and actually, if you have this type of needle, you cannot do this point with this long standard needle. This is too long, too heavy. It will not stay, and it's difficult to target, right? But this, with this small needle, let's call it Korean hand acupuncture needle, with this needle is perfect to do these kind of thing. So these are 0.18 millimeters in diameter and 7 millimeters long. And if I do this, I'm doing this since 2012, so 14, 15, 13 years. 13 years ago, I discovered this turbo acupuncture. And since I'm using turbo acupuncture, I don't need a lot of other points, right? Many points I used in the past before very much. I don't need it anymore because turbo acupuncture does the job already. Yes, and this one needle, I mean, you can get some of these Korean hand needles and put there. I mean, you need to disinfect, normal disinfection, and strictly speaking, here in Germany, you need to wear gloves, right? Strictly speaking. I mean, nobody does it, but according to the law, you should do that. However, disinfection, normal skin disinfection is compulsory, and then you put a needle there. You cannot do much harm. There's no nerve, no big vessel. There's nothing there. So remember, the insertion depth is just 0.2 millimeters for these turbo acupuncture points, including Dr. Tan's grandmaster point. Well, with these ones you can put like 4 centimeters, right? But this 0.2 millimeters, not 2 millimeters, 0.2 to 3 millimeters.